Grace was 74, careful with money, and certain of one thing. Medicaid was for other people, the truly poor, not a homeowner like her. So when her husband needed full-time care and the bills started climbing past $4,000 a month, she never once thought to ask about it. Medicare, the coverage she'd counted on her whole life, paid none of that care. And the program that would have, the one she'd waved off as not for us, sat there unused, because two words that sound almost the same got tangled in her mind. Medicare, Medicaid. One letter apart, and one of them was quietly built for exactly her situation. So what's the real difference between Medicare and Medicaid? Can you have both at the same time? And which one actually pays for a nursing home? Today, in plain English, I'll untangle the two programs that trip up almost everyone. This video covers what each one is and how they work together. It does not cover your state's exact income limits, which you'll need to check for your own situation. Let's start with the one you already know. Medicare is federal health insurance, and the key to it isn't your income, it's your age or a disability. Turn 65 or qualify through a disability, and you're in, whether you're a millionaire or living on a modest Social Security check. It's the same program for everyone. Your income never enters into it. Medicaid is a different animal. It's a joint program run by the federal government and your state together. And the key to it is not age, it's income and resources. It helps cover care for people with limited means, low-income families, children, pregnant women, and, this is the part that matters for us, the elderly and people with disabilities. And because each state runs its own version, the rules and the limits are not the same from one state line to the next. Now here's the thing almost nobody realizes, and it's the whole point of today. These two are not an either-or. You can have both at the same time. When you do, you're what's called dually eligible, and it's one of the strongest positions in the whole system. Medicare stays your main coverage, and Medicaid comes in behind it to catch what Medicare leaves. Let me show you exactly how they stack, because the order matters. When you're dually eligible and you get a Medicare-covered service, Medicare pays first. Then Medicaid pays last, after Medicare and any other insurance you have. So your doctor visit runs through Medicare as usual, and Medicaid quietly mops up the leftovers, the deductibles, the copays, the co-insurance that would otherwise come out of your pocket. Two programs, working as one, with you in the middle paying little or nothing. Picture what that looks like at the kitchen table, because the abstraction hides how big it is. A dually eligible person walks into the doctor's office and, for a Medicare-covered visit, often owes nothing at the desk. Medicare pays its share. Medicaid pays the rest. The prescription copays shrink or disappear. The Part B premium that used to come out of the Social Security check every month stops coming out. For someone stretching a fixed income across rent, food, and medicine, that isn't a technicality. It's a few $100s a month handed back, and a stack of bills that stops arriving. And it goes further than cleanup. When you have full Medicaid alongside Medicare, your state will pay your Medicare Part B premium. That's over $200 a month back in your pocket. And Medicaid covers whole categories of care that Medicare simply doesn't. In Medicare's own words, Medicaid offers benefits not normally covered by Medicare, like nursing home care and personal care services. Read that twice because it's the answer to Grace's whole problem. That's the piece that would have changed everything for her. We've talked before about how Medicare doesn't pay for long-term custodial care, the daily help in a nursing home. Medicaid is the program in this country that actually does. It is the single largest payer of long-term care there is. Grace's husband didn't need a program for the poor. He needed the one program built to pay for the exact care he was in, and it was sitting right next to the one she already had. So why do so many people in Grace's shoes never even ask? Follow it gently, because the reasons are human, not foolish. The first reason is the name. Medicare and Medicaid are almost the same word, so people assume they're almost the same thing. And if you already have the Medicare one, why look at the other one? The second reason is pride and a misunderstanding of it. People picture Medicaid as welfare for the destitute and quietly rule themselves out. But the rules for a senior needing long-term care are their own special set. A spouse who still lives at home is protected. The house is often protected. and many middle-class families qualify once care is involved, especially after they've spent down over time. Ruling yourself out without checking is the costliest guess in the system. There's also a gentler on-ramp that a lot of people miss entirely, short of full Medicaid. If your income is modest but not rock bottom, there are programs, the Medicare Savings Programs, that do just one powerful thing. They pay that Part B premium, and sometimes more, without requiring full Medicaid. It's a partial version of the same help, and millions who qualify never sign up because nobody ever told them to look. Whether it's the savings programs or full Medicaid, the lesson is identical. Check, don't assume. And here's a piece of timing that catches thoughtful people off guard. You might not qualify today and still qualify later, which is exactly why you keep checking. Long-term care is expensive enough that it steadily spends down a person's savings, and as those savings come down, many families cross into Medicaid eligibility they were above a year earlier. The mistake isn't failing to qualify at the start, it's assuming that no is permanent and never asking again as the picture changes. Eligibility is a moving line, and your finances move toward it. Now, one honest caution so you go in clear-eyed. Because Medicaid is run state by state, I can't hand you a single income number that's true everywhere. It genuinely differs, and it changes. That's not me dodging, it's the actual shape of the program. So the move is never to guess your way in or out. The move is to ask the one office that knows your state's rules, with your real numbers in front of them. Has your family ever hit a wall with Medicare, a bill it wouldn't touch, and never thought to ask about Medicaid? If so, tell me in the comments. You are very much not alone, and someone reading needs to hear they're not either. One more thing worth knowing if you or a loved one has both programs. There are Medicare Advantage plans built specifically for dual-eligible people, sometimes called dual special needs plans, that bundle the Medicare and Medicaid pieces together and often add help coordinating your care. They aren't the only path, and they aren't for everyone. But if juggling two programs feels overwhelming, it's worth asking a counselor whether one fits you. The point is simply that being dually eligible opens doors, plural, not just lower bills, but plans and help designed around your exact position. So here's what to do, and it starts with unlearning one thing. Stop ruling yourself out. First, hold the difference clearly. Medicare is yours by age, Medicaid is by income, and you can have both. Second, if a big care need is on the horizon or money is tight, contact your state's Medicaid office and ask directly whether you or your spouse could qualify for full Medicaid or just for help with the Part B premium. Third, do it before the savings are gone, not after, because timing changes what's possible. Assuming the answer is no, without asking, is the only sure way to get nothing. And you don't have to make that call alone or cold. Your state health insurance assistance program, your SHIP counselors, will sit with your real income and your situation for free with nothing to sell you and tell you exactly what you might qualify for and how to apply. Reach them or Medicare at 1-800-MEDICARE. Because the gap between Medicare and Medicaid isn't really about money. It's about a word most people never stop to untangle. Grace didn't lose out because she earned too much. She lost out because she assumed and never asked. And the single question, could we qualify for Medicaid, is free to ask and can be worth a fortune to answer. So tell me below, did you know you can have both Medicare and Medicaid at once? If this cleared it up, subscribe. Next, we look at the mental health care Medicare quietly started covering that most seniors still think they have to pay for. This is general information, not financial advice, and not medical advice, and we are not affiliated with Medicare or Medicaid, so always check your own situation. I'm glad you're here. I'll see you in the next one.